Hi, I'm Dr. Tim Maggs. I'm here with Alan Gadsden for our Concerned Parents of Young Athletes Sports Medicine podcast. And we're very excited every week to at least make people stop and think about it because it's an age group that or a population that really governs so many family schedules. But the schedulers are so busy and so dominated with practices and games that this young athlete becomes the victim in a lot of ways. And Alan, I'm happy to have you on board because as a parent of a young, very talented athlete, you get to witness firsthand this whole issue that is out there. And there is a lot of healthy, but there's also a lot of unhealthy.
Correct, correct. And I mentioned to you several times before, being a fitness professional, I'm a basketball coach myself. My son uh, gets the brunt of a lot of information that I've learned over the course of time uh, on how to, take care of yourself. I don't put the pressures on him as other parents may put on him because I know this is his journey. Uh, and I take a listen to him. If he's telling me something is hurting or he's tired or whatever it may be, uh, I try to balance those conversations because you can, we've come from a generation of his excuse, you can play through this, you can, uh, I did it, you did, you can do it too type of mentality. And we have to be very careful uh, with young athletes because their bodies are still growing.
Yeah, their bodies are growing and their minds are still growing. So every
Right.
year with your athlete, you kind of have a different person there, and it's a fragile balance to keep all of it working and going in a healthy direction. So, but anyways, tonight what we want to do is we want to talk about overuse injuries, and it's a major topic. It's one that needs a lot more conversation, but I think a lot more conversation, Alan, from people that aren't just mainstream, because
Mhm.
mainstream. We talked last week about the exams and how the exams are medical exams. So they're not really identifying or predicting the potential injuries for each young athlete. And then they're waiting for the athlete to become injured. And then they go to the doctors that don't really understand musculoskeletal. And this age group is a victim of that whole scenario. And there's a better way. And that's what you and I are coming here to try to show and talk about. So the overuse injuries, I think we used Caitlin Clark this week as a poster child because uh, I know that I have patients that come in here who are just major Caitlin Clark fans, and they are just like devastated. It's like they just caught on to basketball and the excitement that it brings. They're
Mm,
devastated by her being chronically injured. And it's a
mm.
wake up call to a population out there, Alan, that maybe didn't live through it like you and I have.
Correct, correct. I look at Kate Clark's the overuse and injuries. I just it was 2 weeks in a row uh, that we traveled for AAU, and uh, the amount of kids that were visiting the athletic trainer table uh, blew my mind because they weren't being treated for something minor. You can tell that they were being treated for overuse injury. You know,
Yeah.
overuse of it could be the knee,
Well,
wrist.
it could be muscle cramps,
It could
or
be
it could
right.
be a chronic knee injury that now is hurting more than they'd like
Correct,
it to.
correct. And I saw a lot of kids rubbing, like just cryoderm on one part of the body, and then taping up the left knee, and
Yeah.
a little bit of KT tape on the right knee. So you see this, and these tournaments are long. And one we went to, the first week was a Wednesday to a Sunday, and by Friday you're seeing the same kids at the same table. You're seeing this you know uh, correlation of players playing through injury and overuse of those areas on their body, and it's
And
it's
if
quite
if
evident.
if they have these injuries at this age in the system that they're in, I don't have a lot of optimism. What I always heard lecturing with people out there who were really in the know. At the age of 22, they're dealing with a 30-year-old throwing arm.
Hmm. Hmm.
And
Yeah.
and y-
Yeah, I think too, even when I do sports performance training, as you know, and one thing that we always say, okay, so with being before the injury, you don't want to, stretch a cold body. So we try to talk to young kids about, ballistic stretching and stretching the right way, stretching before and after. Uh, you don't see any of that, and so with even with that, even with a short 7 to 10 minute ballistic stretch, even to get the body warmed up. Our young athletes are not even taking care of our body in that way. And then you say post game uh, prevention, post game taking care of yourself, preventing injury, excuse me, and that all the post game things you're supposed to take care of your body. Those are not happening either because games are back to back so much. So a child could have a game at 10:30. And after that game is over, say 11:30, they may play again at 2 o'clock. And
right,
so, how are we taking care of the body? And then to our overuse of injury, we might have a kid in that 10:30 game that twisted his ankle and does nothing in between there to uh, take care of that twisted ankle, which would you and I would have this conversation all the time. What would it be best is if they didn't play the 2 o'clock game.
right. And that's just,
Right.
I say it's hard because I don't think that there's coaches out there, a standard that needs to be set for coaches to make those decisions, and they're making them from a point of view that maybe is less than caring about the future of the kid. You
Right.
know what I mean?
Right.
And you have parents who either are driven to have the kids play or they're 100% subservient to the coach as to what the coach wants. And I've witnessed all of that coming into the office.
Right.
So,
Right.
and as I've said, Caitlin Clark and Tyrese Halliburton and all of those, their injuries started during their youth sports. And no one looks at it that way. But the
Mhm.
body has an accumulation factor, and the loading lives in the body over a period of time. And so the straw that breaks the camel's back is what they're experiencing now.
Yeah,
So,
and I think with that, the with those injuries with Caitlin Clark and others that started in the youth, I think the big thing, especially for that generation, is the fear of missing out. Uh, if if we miss this tournament, if we miss this tournament this weekend, will my child be seen? If they'll miss all the college coaches
right,
and all this other stuff, and that becomes a issue. And so it's unfortunate because the fear of missing out really plays a big role in the
right.
pressures of making these kids play.
Yeah, it's kind of like a how do you put it? I don't want to say cult like, but it's almost like you get washed away in this mindset of my kid has to play because there's so much opportunity out there, and if we don't play him as much or her as much, he's going to
Hmm.
miss out on that opportunity. And it's kind of we've exchanged what sports means today from back in yesteryear, where it was a learning tool. It was a growing tool, to learn about interaction with other people, communication, conditioning. Now it's become a fever. Sunday we don't go to church. We have games. It's
Hmm.
become the new
Hmm.
religion. And so it
Hmm.
really has taken over. So my motivation in asking you to join me on this is to, okay, I get that. We're not going to change that. It's a drug. Yeah, everybody loves it. The parents love it. The kids love it. But let's start doing it better.
Right.
You
Right.
can't have a system governed by our health insurance guidelines taking care of these kids because that just doesn't exist. The care
No.
isn't there.
No. And I think we have to. You and I will continue to share this message, but we have to speak it a little bit louder that the long term is much more important than the short term.
Yeah, the costs over that child's life, the cost to society and the cost the child will have to pay is enormous, and no one looks at that. No one
Right.
looks at that. So there's two main causes of overuse injuries. The one that is ignored is biomechanical faults. The one that we live with is overuse. So all of these kids, Alan, are in the overuse
Hmm.
category. So it's a matter of when does it get bad enough to go see a doctor? But the one you can't control that because you're not going to, coaches don't allow, okay, take 2 days off, or you only practice on Wednesdays, or, the schedule is set and that kid's got to participate. You don't have as much flexibility there. Where all of the flexibility is number one, looking at the
Hmm.
biomechanical faults, because the biomechanical faults are without a doubt precursors to every injury that every kid has. We had the article in the paper last week, injury
Yeah.
prevention begins with youth sports. I'm now on a movement to try to get a syndicated column nationally on youth sports injuries because
Hmm.
it's tomorrow's world. These kids are going to become tomorrow's world,
Right.
and it's just not fair of us to allow them to go in there limping on crutches with disabilities at the age of 20.
Hmm. Right.
It's
Right.
a responsibility that we have. So what are biomechanical faults? Here is the most classic one. This young man came into my office in 2006, had behind his knee on the left pain and left Achilles pain,
Hmm.
and he ran 3 seasons a year at Niskayuna. So this was during his cross country season as a sophomore. We did what we did, and he completed all of his running at Niskayuna and graduated with no further injuries. So it was a great story, but this is a visual that shows this is what biomechanical faults look like, and no one is looking at this.
No.
I was going to tell you earlier the one fact. I had a podiatrist in today, and she said she has never in her life seen as many young girls come in with Seaver's disease, which is heel pain. She
Mm.
said the overuse injuries today is off the chart,
Wow.
with young
Wow.
kids. So
It's
she's a recipient of these injuries, as many of us are. But I'm saying no, no, no. That's not how we can't do it that way. Can't do it that way.
yeah.
So, what are the biomechanical faults? Well, here's an example, and we look at this, and it's a critical example. The left hip is 7.1 millimeters higher than the right hip. It should be 3 or below. So that's one of the measurements we look at. On this low back x-ray, to the left is the abdomen, to the right is the buttocks. That long vertical red line is the center of gravity. It should be going through the short red line. The fact that it's ahead of changes the areas of loading in that spine. So over time, there's going to be increased loading going through areas that are not designed to handle it, predisposing this young individual to a variety of potential injuries. And this can be determined long before the injuries, and corrections can be made. And that's what we're here today trying to talk about. So the one thing I wanted to do, Alan, is people really understand that there's 3 phases of injury. And the first one is soft tissue inflammation. So that would be a strained sprain of a knee, a pulled calf muscle, an Achilles tendonitis, that type of thing. And generally, there's no testing that can be done. It takes maybe the experience of the examiner or the coach or the parent on, okay, we've got to give this a chance to heal. And we use laser therapy primarily to heal these types of injuries. Here is an MRI. Now, one of the points I want to get across today is to detect inflammation, an X-ray will not do that. You have to have an MRI. So here we can see shin splints in the muscle fibers of the shin. There's inflammation, the white patches. Now, you
Hmm.
don't get MRIs for soft tissue injuries. Okay, so you have to have someone experienced enough. But a soft tissue injury is typically a result of biomechanical faults.
Hmm.
So, yes, everyone out there can go in there and have a treatment for the soft tissue injury. They can even tell them take 2 weeks off, which in many cases is a good thing to do. But we're not looking at the biomechanical faults that are the precursors to these injuries.
Hmm.
So now, one of the treatments online, Alan, if you look up how do you take care of shin splints, one of the treatments is sit on the edge of a table or a bench or whatever, and put a paint can over your foot, the handle of the paint can, and then do some toe raises like
Mm-hmm.
this
Mm-hmm.
in an effort to strengthen the muscle. Now,
Right.
you have a muscle that's full of inflammation because it's been overused. And so a lot of the recommendations out there are just entirely wrong. They don't understand the physiology of what's going on.
Correct.
So you have to allow it to heal. Now, I say any tissue will heal, do more good than bad. We now use laser, which is, in my opinion, the most advanced therapy out there to accelerate healing of injured tissue. But that's one of the therapies that you can use. Old school, maybe do ultrasound. Um, they have a few new, shockwave is a new therapy out there, but laser, I think, is the one that's the most advanced out there to help to get soft tissue injuries to heal. Because with the patroons, I was their doc for multiple years. They all have soft tissue, micro tears, swelling. That's part of the game. But you
Mm-hmm.
have to keep it down as they're in season. So
Right.
the biomechanical faults, the more balanced the athlete is, the weight distribution's more balanced. And then we would laser a lot of the players if they had chronic knees, even if the knees weren't symptomatic, in an effort to keep any potential inflammation down.
Mm.
So, but what happens is these young kids, no one looks at them until it's so bad
Right.
that they have to go to a doctor. And then the
Right.
doctor is not equipped in any way. They'll refer them to the physical therapist. And again, I've seen across the board, like chiropractors, I'm a chiropractor, across the board, this physical therapist does entirely opposite of this physical therapist. There's no
Correct.
standard out there. And that's dangerous because, again, in a case like this, when you exercise injured soft tissue, that's the wrong treatment.
Mm.
So there's number one. Number two is bone inflammation. So when you ignore it and it gets into the bone, whole different story now. Bone inflammation is bone marrow edema. Edema is inflammation of the bone. Now it goes to a 1 to 2 to 3 month time frame to get that to heal. So
Mm.
what does that look like? And again, you have to have an MRI. Here is the low back, and this is the condition I probably talked to you about, Alan. I talked to everybody about it.
Mm-hmm.
Spondylolisthesis, which is very common in middle school, high school kids. And you see that white patch is inflammation in the bone. This athlete, once that's identified, has to stop all sport for 3 to 4 months. They
Mm.
have to put on a hard, rigid, custom made belt support that they have to wear 23 out of 24 hours a week. A day, I'm sorry, 23 out of 24 hours a day. And then going through treatment only will accelerate the healing. But most docs out there don't understand this. They give the wrong recommendations. They don't do the right tests. I mean, there's so much confusion out there with a lot of this. Here's another one. This is a bruised knee. You can see, so the white on an MRI is inflammation, and that tells you it's a 1 to 2 to 3 to 4 month time frame, depending on the degree of the injury. And if you ignore that, it goes to a stress fracture. So, Alan, in your field, how many kids you've heard have a stress fracture in their leg, in their shin, their
Yep.
ankle, their hip, because
Yep.
you have no program out there detecting it or making proper recommendations. So, a stress fracture. Now, this story right here, Alan, this one shocked me. I had a young athlete from Shaker on the track team. Mom brought him in, and he had pain in his hip and pelvis. And I said, okay, we want to start with a couple x rays. She said, I'm not sure if my husband would want them. I said, well, I can't help you if you don't, and I said, why doesn't he want them? And is what I just said about the difference. He's a chiropractor and he just doesn't like x-rays. I said, okay, well, you're going to need to get him on the phone if you want me to continue. She got him on the
Mhm.
phone. He agreed. What you have here, it's a stress fracture of the ischial tuberosity, which is the if you ride a bike, the bone that gets sore from sitting on the seat.
Mhm.
And that's a part of the pelvis and the hamstring is attached to that. And the imbalance in weight distribution was so significant, it pulled a piece of bone off his pelvis.
Oh God.
And they call that an avulsion fracture.
Hmm.
And that's the only one I've seen in my whole career.
Wow,
But
that sounds like.
that's a stress fracture. That's ignoring all signs and symptoms. But that's
Hmm.
how powerful these injuries can be. And
Yeah, that sounds like that hurts.
it sounds like it hurts, but I ask, what's his future if that's happening at this age? And I don't know.
Right.
The parents took him to Shriners, and I never heard from him again. So,
Mm.
but at least he knew what the problem was. And then the final stress fracture here, you can see the lowest vertebrae here, and the fracture is right here. Can you see that little hand I've got on the screen, Alan?
I sure can.
Okay, so there's a fracture right there, and you can see it should be lined up back here, but this bone is moved all the way forward. And that happened. It happens one of two times in young athletes' lives, either during the toddler phase where the pain doesn't register. So you ask them, when did you hurt? And they say, I've never hurt. It happened during the toddler phase, or it happens during middle school, high school. And when it happens, there's inflammation in the bone, and they're out of competition for 3 to 4 months.
Wow.
So very common condition. I tried to get section 2 to allow me to get information out to all the trainers and all of the coaches about this. It's such a common condition. They wouldn't do it. They wouldn't allow it. So now, you know,
Too bad.
kids live with just their bad stories. I've got a lot of bad stories. So here's the full version. This is every young athlete, beginning with collapse of the feet, rotation of the knee. We saw that one picture, and unlevel hips, and all the way up. And this is the variable that you can control. So again, here we have our young man with the knee and foot. We do our structural fingerprint exam. It's surprising, Alan, but today still, this is the only biomechanical exam in the country. So if you go online and Google biomechanical exams, it's all podiatrists.
Mhm.
There's no other full body exam, and it's just shocking that no one has learned that yet. But it's all standardized tests that we do. It includes 4 X-rays. We do physical exam, and in the corrections that we make on it are objective, not just subjective. Then
Mhm.
we have a lesser exam where the patient comes in, we put them in orthotics because we know that they need them, and we take 1 X-ray to make sure their hips are level. So that's for the family that doesn't want to invest in the full exam. But here you can see the goal that we're going after, Alan. This is why you're sitting there and why I'm sitting there. And
Mhm.
this is why this young man was able to run for 2.5 more years without injury, because we were able to do what had to be done to create that balance. Now, the interesting piece, look at this young man's left quadricep disengaged compared to the right. And now
Yeah.
look at over here, it's
Yeah.
engaged.
Yeah.
So he's a car crash in the before, and
Yeah.
yet I see it every day with every kid that comes in here. If you don't see it, it's not that big a concern for you. I witness it every day, and it's just it's mind blowing that no one else is seeing it. So
Yeah. Well, again, we are looking at everything in its totality, the whole body.
whole
You know,
body,
you're looking at everything where sometimes the medical field, even sometimes in the sports performance and fitness field, we look at the one area, um, and that's the mistake that we make a lot of times, and that's the and then when I say we make as parents, we make that mistake a lot of times because we look at the area,
yeah,
and but we don't look at the entire body. In fitness, we'll talk about the body being a kinetic chain, and we'll look at ears and shoulders. We talk about all the alignment, but we can look at the alignment from a physical standpoint and say, stand up straight. Well, that's great. You stood up straight, but again, without an X-ray, without all the other things that are involved, we're doing the child a disservice. And I'm not saying those things don't work. I think it has a place, but we have to also look a little bit more deeper into a
right,
young athlete to be able to help them and to be able to have this. this bridge that you and I are trying to build a little bit longer for people to walk across to get help, I think is a great thing. It's just that fear of missing out, and the change of how youth sports is that kids are playing so much. There is an overuse of injury, uh, and there is no time off. There's the days of your child playing on one team is over. So if your son or daughter is playing on one team for this weekend, they may have the next 3 weekends off, but there's another team across town that might have uh,
Right.
another tournament to play. So your kid just goes there. Now here's another big problem there. Those two coaches may not even know each other, and even if they do, they're not texting or calling each other saying, "Hey, listen, Tim, hurt his knee last week. I don't think it's a good idea that he plays for you this weekend. Maybe you should tell the parents, just like I told them, maybe they should take the day off, the weekend off." Those kind of conversations.
Well, and keep in mind, I just got a text before I came on ESPN. Tyrese Halliburton said he thinks his torn Achilles had a lot to do with bad luck. Okay,
Oh, that's
so
what.
yeah, that just came before I came on.
Yeah,
And
that's
what
what it is.
happens is, so if you're a coach with a kid with a bad knee, you have no idea why he has a bad knee. So there's really not a lot you can report. Even if you did give a scouting report or an injury report, he's got a bad knee. You don't understand why, the degree of it. Is it soft tissue? Is it bone? Stress fracture? You have no information. So that's
Right,
probably part of why we're not going to take the time to tell you about John. Johnny will tell you about his knee,
right,
you
right,
know,
and
and Johnny will
right.
play until he can't play,
Right, right.
you
And
know.
then that's when you'll see more players during the season sitting on the sideline or not playing at all because they couldn't take this time, we talk current, this summertime, to really just, you know, take care of those injuries the way they're supposed to be taken care
Right.
of, and have a
It,
more productive season.
it's a major, major, major issue. I'm just and I appreciate you taking the time. I'm just trying to get those interested saying, yes, let's step up and become part of the solution. So we
Yeah,
got a lot of work ahead of us, but I can't think of anything more exciting to try to improve upon than, helping the next generation have a more enjoyable, pain-free life, you
I
know.
agree.
So it's a good cause. Well, and thank you so much. As always, I appreciate it. We'll be back next week, and I'll get this out, Alan, and keep up the good work. Let me know if there's any questions with regard to Charles, but possibly I'll see you tomorrow then.
Yeah, yep, no question about it. And
Stop
when
in.
you get me the link, I'll post this on my social media pages too and get the word out.
Wonderful. Wonderful. Thanks much. Have a great day.
Yeah, you too.
Okay. Take care.